And so are the germs that come with it. And while it's usually easy to tell when a child is too sick for school, sometimes it's not so clear. So joining me to talk about this, we have Dr. Shriver with AdventHealth Castle Rock. Thank you so much for joining us.
Absolutely. Thanks for having me here today.
So the big question every parent wants to know, like they could send their kids to school, but sometimes it's probably not the safest. What are those symptoms that people should be looking out for?
Yeah, absolutely. So as a parent myself, I understand the difficulty that families face when they're trying to figure out, should I send my kid to school? Should I keep them at home? Our goal is really to decrease the risk of contagious symptoms spreading to our classmates or teachers, as well as their families. So symptoms to look out for be a fever of 100.4 degrees or higher, vomiting, diarrhea. You also want to see how their energy levels are. If a kid is too tired and too sick to get out of bed, they're likely too sick to go to school as well.
Then we also have seen mild symptoms. We have a little cough or, just a little bit of sneeze. Should that be okay to send kids to school?
Typically, yes.
Okay.
We really want to encourage school attendance whenever we can. If there are just mild symptoms, that's A-okay. What we do want to do is monitor those symptoms, because if they start off as mild and become severe, or start off as mild and develop a fever, that'd actually be a reason to see your doctor.
And then you were talking about those contagious symptoms. How long do those usually last?
Yes, so for the contagious symptoms, typically for a fever, if we want to make sure kids are staying out of school for at least 24 hours after that last fever, and usually without fever-reducing medications. So that's typically the guidance of most districts in the area, and I do recommend following the guidance of the actual district that you're in.
And parents, I'm sure they're thinking, let me call the doctor right away, because that's the first thing that you want to do. When it comes to certain symptoms, when should they contact their doctor, and when should they just treat it at home?
Right, so if we are sick with respiratory symptoms, meaning lung symptoms of fast breathing, deep breathing, or wheezing, especially in kids with asthma, that would definitely be a reason to call your doctor. Now, fever typically is okay and is actually your friend in terms of school-age children. But we want to monitor how long the fever is lasting for and really how your child is looking with that fever. So fever lasting more than 3 days, or if it's the fever is so severe that it's draining their energy and they're not really feeling like themselves, that's absolutely a reason to call your doctor.
And then after being sick, when should they go back to school?
So we recognize that there are some leftover symptoms that can happen with viruses. A lot of times coughs can last for several weeks. And it's something that once you get over that initial contagious period of an illness and that cough, the cough can last and be something not to, that wouldn't be a reason to keep them at home. It's something they can go to school with.
A lot of folks are heading back to school. I think Jefferson County is starting tomorrow on Wednesday. We've already started back to school stuff. When should, or how should parents stop the spread of the, any type of germs? What can they do to make sure that their kids are not coming back home sick?
Right, so as a parent myself, I completely understand, in terms of kids, kids are like sponges. They soak up anything and everything. And it's something that hand washing is our #1 best defense against keeping those germs away. We want to make sure that we're washing our hands before we eat. Also, if we want to make sure our hands are clean before we touch our face. It's also important to make sure that shared surfaces at school and at home are clean, to avoid sharing utensils or drinks. And it's definitely something that we need to make sure that we are preventing the spread of illness at home and school.
Dr. Shriver, very good advice. Thank you so much for coming in. We're going to be right back right after the break.